Sex worker community-led responses to COVID-19. Sex workers were among the hardest hit at the start of the COVID-19 pandemic and continued to be impacted by this global public health crisis. Protection measures in many countries, such as lockdowns and curfews, as well as shortages of medications and reduction in treatment, prevented sex workers from accessing vital health services. As governments failed to provide adequate assistance in their emergency responses and social protection mechanisms, sex worker-led organisations around the world stepped up to support their communities. Best practices of community-led support include provision of food, money and medical supplies, emotional support and solidarity, support with access to services and navigating bureaucracy, knowledge and skills building, political campaigning and awareness raising. Sex worker-led initiatives to support sex workers during COVID-19 show that community-led responses are the most effective way to save communities during global health crises. Sex worker-led organisations were often restricted by insufficient financial resources for responding to the different needs of community members. Recommendations: 1. Sex worker communities must be directly involved in developing and implementing responses to COVID-19 and future pandemics. 2. Sex workers must be included in national social protection schemes, including health insurance and sick pay, and other emergency responses. 3. Sexual and reproductive health and HIV treatment services must not be disrupted during pandemics or other humanitarian crises, and must be more sustainably funded. 4. Governments, policymakers and civil society advocates must actively work towards the full decriminalisation of sex work, including sex workers, clients and third parties.